All right, I think we're ready to go. Let me pull this down. Hello, my name is Eric Booth. Today is August 18th, 2020, and welcome back to my YouTube channel, Dr. De La Vicia. Like and subscribe. I'm pretty sure you forgot on the last video, but I'll forgive you this time. So today we'll be talking about Unit 4 case studies. I chose to answer 1 and 3, and hey, I guess Pouty the Gouty Clown is 47 years old. Just jokes, but let's get into it. So case 1, there's a few pieces of important information to gather from the prompt. We know the patient is lethargic, hypothermic, and experiencing apnea. Her blood ammonia levels are 314 micrograms per deciliter to start and rise to 600 micrograms per deciliter at the time the testing is over. Her uric acid level is 473 micromoles per liter creatinine. However, her plasma citrulline levels are normal at 10 micromolar per liter. So the prompt gives us 4 choices to choose from. Those choices are blood glucose, urinary acids, serum fatty acids, and plasma glutamine. These tests are to determine if it's a urea cycle or beta oxidation disorder. So for this one, we'll just start with the best diagnostic tool. Plasma glutamine is the only test that would test and indicate a urea cycle disorder or beta oxidation disorder at the same time. As we know, glutamine is important for the clearance of free ammonia, and ammonia is very toxic, and since glutamine is a great antioxidant, go hand in hand. So if there was a defect in the urea cycle, we would see an increase in free ammonia and plasma glutamine. However, if there was a defect in beta oxidation, glutamine levels would remain normal. So the other choices are just not appropriate. Testing blood glucose would be pretty pointless since blood glucose isn't relevant to the urea cycle. So you wouldn't be able to test for the urea cycle or beta oxidation difference. Urinary acids would indicate citrulline levels, but do not denote a change in beta oxidation. On the contrary, serum fatty acids would address the fatty acid deficiency, but not urea cycle. So again, glutamine is the only test that can tell both. So the lab reports, after looking at them, let me pull down here. After looking at the lab reports, they confirm an OTC or ornithine transcarbamylase deficiency. According to NORD, this is an X-linked trait. In boys, we see serum ammonia levels being higher, and in girls, we see hyperammonemia, lethargy, and apnea. So all of these symptoms are seen by the baby, and the baby is female. An OTC deficiency triggers increased carbamyl phosphate levels. This in turn raises uric acid in urine. This is what differentiates an OTC deficiency and why it's not a CPS1 deficiency. We then see uric aciduria and academia, which are seen by the baby as well. So let's move on to case 3. So again, always starting with pertinent information. We know that the patient is diagnosed with gout. He has increased levels of plasma urate, decreased urinary acid levels, and stated his diet consists of 4 to 5 liters of soda a day, which contains high fructose corn syrup. So there are 3 possible cases of gout. When assessing for gout, we look for an overproduction of purines, decreased salvaging of purines, or a decreased clearance of uric acid in the urine. A study in 2012 stated there's about a 90% chance of the diagnoses being decreased clearance in the urine. So after evaluating the patient's tests, he is a part of the 90%, which means he has an increased production and decreased clearance. We know this because normal level for men is 7 milligrams per deciliter of uric acid in the blood, and the patient is actually above that by 3.5 milligrams. His tests show that he is actually at 10.5 milligrams per 100 milliliters. So that's quite a bit up. The body carries the uric acid in the blood, and it's usually processed by the kidneys. So when there's an excess and it's not being cleared as well, it leads to depositions in certain joints and kidneys. That's why the big toe, I think I might be covering up the picture here. That's why the big toe is usually the first place people experience a gout attack. It's usually kind of what you think of whenever you think of gout. So clearance can be impaired due to certain kidney diseases or usually a high purine diet. Most of the time it is due to the diet. So when thinking of gout, many people who haven't done as much research would probably think of red meats, and they would be right. But there's many other types of food and food groups. So when researching, Mayo Clinic stated that the large factors, again, do include organ and game type meats. So that's all your red meats and mostly cows eating a lot of steak. But there are certain types of fishes, and there's lots of juices, particularly fruit juices. All of the sodas, especially the ones with the high fructose corn syrup, and some alcohol, and there's other food groups as well. So as we know from the man's statement, he is drinking 4 to 5 liters of soda a day. To be put into perspective, that's literally an entire case of Coke. I mean, I don't know if he's just having too much fun at these clown parties or how he hasn't gotten sick of it yet, but that's a lot of soda. So these types of foods are metabolized into uric acid. So when we eat a lot of them, we have more uric acid, thus increasing risk for gout attacks. So statistically speaking, alcoholic beverages are usually the first trigger, or the reason why many people have their first gout attack. So most people would look for a dietary modification before trying out medications or drastic life changes. So you would look at a decrease in the purine-rich foods. I mean, these are very simple modifications, and a man can live a very happy life. Pouty the Gouty Clown will have his shows go on. So again, decreasing all of the food that contains all of the ones previously mentioned. So swapping red meats for lean meats, eating more chicken, having a few less drinks, decreasing those simple sugars for complex carbohydrates. So all of that soda that the man was drinking, those are all simple sugars. So the easiest modification for him would just be to cut back to, 3 Cokes a day at least. And just replace the rest of it with water. There is some evidence towards vitamin C supplements. These help increase uric acid clearance and decrease gout attacks. So we know it is a decreased clearance and not an overproduction or decreased salvage of purines from the test alone. We need more information before we can say otherwise. We would start by looking at past medical history and personal medical history. Gout often runs in the family, and a previous positive may be an indication of an unfortunate trait passed along. If all negatives, the specific test would be to look for an HGPRT deficiency, which of course is short for hypoxanthine guanine phosphoribosyl transferase. But since we don't have those tests, we can conclude that it is just a decreased clearance. So here are all of my sources that I used. And if you have any questions, please put them in the comments. Again, like and subscribe, and we'll see you guys soon.